Good morning, everyone, and thank you for joining us today. We are really excited to walk you through some of the new AI features we have added to PrognoCIS. We'll walk through all the three features which are part of PrognoAI, as well as I will give you a demo for each of those features as we go through them. Now, one of the biggest complaints that you hear from a provider is how much time they spend on the computer, documenting the notes, searching for information, and reviewing charts instead of being focused on their patients. And that's exactly where AI features are designed to fix. So they are built right into your prognosis so that providers and staff, they don't have to learn a new system or break their workflow. And the idea is to make prognosis a more of a helpful partner when they are with the patients. So today we are going to walk you through three of the main features that are part of PrognoAI. The first one is the PrognoAI chat. Then we have the past visit summary. And then finally we'll have the AI Scribe. So all of this together is built to save time, reduce the documentation burden on the provider, and ultimately to give the providers what they require, which is the focus on their patients during their visit. So here are the three main features that we are going to go through. So we have the PrognoAI chat, which is a chat pop-up in PrognoCIS or integrated within your PrognoCIS and available to you on all the screens. And you can use it as and when you want. And it is more for you, for the PrognoAI to respond to your clinical questions. You have quick access to it. Like I said, it's available on all your screens and it's embedded within PrognoCIS. The second one is the past visit summary, wherein before you start your visit with the patient, the past visit summary gives you a clear overview of the patient's historic data from his past encounters. It summarizes the progress note from the past encounters and gives you all the important information that you need before you start conversing with your patients. And finally, we'll walk you through the Scribe and the Scribe summary, which is built to capture the conversation between the patient and the provider. It can differentiate the speakers when the patient or the provider is conversing with the patient, as well as once the conversation has been captured, it will summarize and also help you create the final progress note within the context of that conversation. So first, let's look at the PrognoAI chat. So PrognoAI chat is, like I said, it's an icon that's available on all the screens of PrognoCIS, be it the EMR or the billing. And it's built to respond to your clinical questions. Now, this PrognoAI chat feature is available to all the clinic users, be it the provider, the clinical staff, the medical assistants, or your billing staff. And for each of the response that PrognoAI gives you for your queries, wherever there is a source available, it will also show you the source of the information so that you can easily verify and it's transparent. So you know that the source is or what is the source of the information or the response that the chat brings to you. So let me go ahead and give you a demo. So I'm logged into my PrognoCIS here and I'm on the home page. I have few appointments scheduled on the screen. Now on the right side of your screen, you'll see a new icon that's available here. And when I hover over it, it opens an icon within it, which is for the PrognoAI. Now this notch is movable. So in case it's overlapping any of the information on the background, you can move it either up or you can move it down. And once you hover over it, you'll see the icon. And once you click on the icon, the PrognoAI chat pop-up opens. Now, like I said, this hover is available to you on all the screens. So be it on any screen of PrognoCIS, you will have this icon available. And when you click on it, it opens the PrognoAI chat. Now, like I said, let me reiterate that it's built in to respond to your clinical queries. And we also recommend that you do not share any PHI data within the chat. So let me go ahead and type in a quick question here. So the question I'm asking the chat is, what is the recommended colonoscopy interval for an average risk adult over 50? Now, when PrognoAI responds to it, it tells you that according to the American Cancer Society, it gives you the guidelines for the specific adult for the age of 50, and the screening colonoscopy is recommended every 10 years. And then you have additional guidelines at the bottom. And then you'll see that it also lists out the source of the information. So it tells you where this information was provided from. Now, at the bottom of each of this response, you will see that there is a thumbs up and a thumbs down icon. The thumbs up icon gives you the positive feedback to the response. However, if you are not happy with the response, you can click on the thumbs down and it opens up a feedback pop-up where you can let us know what is it that can be improved. And so if you type in your feedback here, this information is sent back to the PrognoCIS team so that we can help improve the responses from the PrognoAI chat. Now, the PrognoAI chat, like I showed you, it opens in a pop-up, but it's a little different when you're working on your patient chart. So we'll come down to the patient chart and I'll show you how it works, or how does it open when you're in a patient's encounter. Now, before we go to the encounter, let me also talk about the past visit summary. So the past visit summary is available on the home page. So on the home page, you see all the appointments that are scheduled for the day. And you will also see an icon on the home page. When you click on the icon, it will fetch the past or summarize the past visits of the patient. And this summary will highlight the relevant diagnosis, the medications, any orders from the previous encounters, and the provider's impression from those encounters. It also gives you an overview of the previous encounter history, be it specific to the provider, or it could be a provider that from another provider's encounter, or it could also be configured to fetch the past summary for a specific case number. So if you are using the case management module and you want the summary to be very specific to the case associated with the appointment, it can be configured for that too. Now we have different formats that are available, and you can select any one of the format. So one format is where you can see on the left here, where section wise it gives you a summary from the previous encounters of the patient, or you could have it like on the right, which is visit wise. So each visit it summarizes and then lists out with the first new patient encounter right at the top, followed by the follow-up visits. And there is another third format, which is the combined summary. So going back to prognosis, like I said, we have the patient column on the homepage, and I have all the appointments scheduled for the day. I see an icon here next to the patient, in the patient column, next to the patient name, which lists as the past progress note summary. And when I click on this icon, it will load the summary of the past encounters of the patient. Now, it can go back to the past 5 encounters of the patient and show you the summary from those encounters. And how is this summary created? So there is a process that is run at the midnight for your appointment scheduled for the next day. And the process will make sure that for all the appointments for the next day, it creates the past summary and keeps it ready. So that the next day when you start with the appointment, you can quickly click on this icon and you'll see the summary here and go over the summary before you walk into the exam room with the patient. Now, like I said, this is the section-wise summary. That means for each section, it has summarized from the encounter which was done on September 3rd and the second which was done on the 11th of September. And based on the details that's available to him for the past summary or the system from your past encounters, you will see that date-wise it has given you the summary. Now, like I said, there are different formats. So that was the section-wise summary. The other format you get is the visit-wise summary, wherein for each visit, it summarizes all the sections and creates a paragraph out of it. It picks up all the important information from the progress note and shows it up here. And the third format that you will see is the combined summary. So this is a combined note from all the past encounters, and it tells you that how was the patient, or what was it from the initial encounter, and each of the follow-up visits, how did the patient's health progress, or was there anything that you need to know if it has worsened. And if you'll see, even the past progress note pop-up at the bottom, it has the thumbs up and thumbs down. And similarly, when you click on the thumbs down icon, you can provide us a quick feedback for us to help improve our PrognoAI based on your feedback. So that is about the PrognoAI chat and the past progress note. Now let's go ahead and go to the encounter. So the patient's encounter has been marked arrived. I will start the encounter or go into the patient chart. And here you will see that we have 3 panes here. We have the left pane, which has the TOC options. In the middle pane, you have your face sheet and all your different sections, TOC sections. When you click on them, it loads in the middle pane. And on the right pane, you have the PrognoAI tab. So in case if you do not want this tab to be open, you can close it here. And if you want to reopen it again, you can go to the hover here, click on the PrognoAI icon, and that should open up the third pane again with the all the PrognoAI features within each tab. The other way to open this is right on the top. You have the vertical ellipsis, and you'll see the option PrognoAI also available here. And when you click on it, it opens up the third pane. Now the default tab on the third pane is the PrognoAI chat. Like I told you, for all the other screens, other than the patient's chart, the PrognoAI chat opens up in a pop-up. But if you are on the patient's chart, it will open in the third pane, and the overall working remains the same. Just let me go ahead and add a query here. So what I'm asking is, what are the latest ADA diagnostic criteria for type 2 diabetes? And as it responds, like I said, it will respond for your query, as well as at the bottom, you will see the source of the information. And for the provider, they can go ahead and verify this source. And again, you have the thumbs up and thumbs down at the bottom of the response. Now, because the third pane is always available to you, in case for any of the queries, you need to copy any of the content to your chart, you can go ahead, select the content and copy it. So that's the first tab you have here, which is the PrognoAI chat. And like I said, on the home page, you have the past summary. Similarly, one of the tabs you'll see here is the past summary here. And it shows you the same content or the format of the past summary that you saw on the home page. You have the option here to copy the content or select any specific content that you need from here to be copied onto your current chart. Or if you want to refer to the past summary, you can always refer to it from this tab as you're working on your current chart. Now the final vast feature that we have is the Scribe feature, which is, you'll see that there's the Scribe tab here. You have the Scribe summary. So once the conversation has been recorded and captured, it will summarize under this tab here. And then finally, once the contents of the summary has been reviewed by the provider, it will go ahead and create the progress note. Now, before we start with the Scribe feature, I just wanted to convey here that the Scribe features are available only to the providers who are added to the system, and it's not available to the staff. So now when I select the Scribe tab, you will see at the bottom that we have the record button, we have the stop, and once the recording is completed, if you want to go ahead and replay your conversation that was recorded, you have the replay audio icon here. Now I'll go ahead and record a conversation that I have between a patient and a provider. When I click on the record icon, it will ask me to make sure that I have the consent of the patient, so that the patient knows that this conversation would be recorded and they consent to it. And we also let them know that it is mainly for the documentation purpose and would be strictly maintained as a confidential conversation. Now, the other thing that I would like to also inform here is that when you're capturing the conversation that you're going to have with the patient, you can add a third-party device like a mic to your laptop so that it captures the conversation much better. Or we also have a way to capture the conversation from the PrognoCIS EMR app. So if you're registered to the PrognoCIS app and it's downloaded on your cell phone, you can go to the PrognoCIS app and on your cell phone, and from there you can record the conversation. So basically you will be carrying your cell phone into the exam room, start the recording from the cell phone, wherein it will capture the conversation. And once the conversation has been captured, it will be transferred to your EMR so that you can see it from the laptop. And then you can go ahead and finalize your progress note from the EMR or the PrognoCIS web. So let me go ahead and play the recording here. So like I said, I'll go ahead and click on the record icon, and it will show me the consent that is required both from the patient and the provider. And it's more of for the documentation purpose. Now, when I click on this checkbox that the consent is received and save, the recording is going to start, and I'll start playing the recording that I have here. So let me go ahead and click on save.
Good morning. I'm Dr. Welby. What brings you in today?
Hi, doctor. I've been feeling really tired lately. It's been going on for a few weeks now.
I'm sorry to hear that. When did this start?
About 3 weeks ago. I just feel drained all the time, even after a full night's sleep.
On a scale of 1 to 10, how bad is the fatigue?
Around a 7 or 8 most days.
And is it constant, or does it come and go?
Pretty constant. I wake up tired and it sticks with me all day.
Any other symptoms, like fever, weight changes, headaches, or trouble sleeping?
I've had some difficulty concentrating, and I feel low energy mentally, but no fever or weight loss.
Understood. How has this been affecting your daily life?
I've been less productive at work, skipping the gym, and I just don't feel like myself.
Any allergies or tobacco use?
I have no allergies. I also don't smoke.
How about alcohol?
I drink occasionally on weekends, maybe 2 or 3 drinks.
What do you do for work?
I'm a software engineer. It's mostly desk work with long hours sometimes.
And exercise?
I used to work out 4 to 5 times a week, but I haven't been able to keep it up since I've been so tired.
Any chronic conditions like diabetes, thyroid issues, or high blood pressure?
No, nothing like that.
Any hospitalizations or surgeries in the past?
Just an appendix removal when I was a teenager.
Are you on any prescription medications or supplements?
Just a multivitamin and sometimes melatonin to help me sleep.
Your vitals today are normal. Temperature 98.4, blood pressure 112/74, heart rate 76, and respiratory rate 16. By the way, do you have kids? How are they doing?
Yes, I have 2, a 6-year-old and a 9-year-old. They're good, very active, and keep me on my toes.
I can imagine. That must be tiring too, but also fun to see them grow. Do they have any hobbies or activities they really enjoy?
My older one loves soccer, and the younger one is really into drawing and crafts.
That sounds wonderful. It's nice to have something joyful to focus on, especially when you're feeling worn out. Based on what you've told me, this sounds like persistent fatigue without urgent warning signs. I'd like to order some basic blood work, a complete blood count, metabolic panel, thyroid hormone test, iron studies, and vitamin B12 and D levels. Does that sound okay?
Yes, that makes sense.
In the meantime, I recommend regular sleep habits, light physical activity is tolerated, staying hydrated, and paying attention to nutrition. I'll prescribe vitamin D3, 2,000 IU daily for the next 30 days. We'll schedule a follow-up in 1 week to review your test results and see how you're feeling.
Thanks, Dr. Welby.
You're welcome. Take care.
Now you must have noted that when I clicked on the record, the icon that showed was the pause. So in case during the conversation and you want to pause the recording, you can click on pause. And once you're ready to continue, you can click on the record again and it will start recording the conversation. Now in case you clicked on stop, so you will see that the audio file is being saved successfully, and it will also create a summary. And once the summary is ready, you will see the transcript was saved to file. Now, in case you want to continue this conversation, you can again click on the record icon here. And it tells you that do you want to discard the existing recording and start over, or do you want to resume? So if I click on continue, I can continue the recording from where I had stopped it and make sure that the existing recording stays there. Now, in case I want to replay the recording or listen back to the conversation I had with the patient, I can click on the replay audio here. So it plays the complete conversation that it recorded. And you can also move to a specific section of the recording if you want to go back there. Now, once the recording has been done, you'll see that under the Scribe summary, it gives you a short summary of the complete conversation. And now to use this to create your progress note, you can click on the Proceed button at the bottom. So when you click on Proceed, it opens a review pop-up wherein you can review the contents. So whatever the conversation that was recorded, AI will make sure it separates out into 5 different sections. So those are the history of present illness. You have the vitals, the review of systems, the physical exam, assessment, and plan. And for each of this section, you'll see that it has created or generated a content out of it. So based on the context of the conversation and the complaint, it creates this content. And in case you want to add to this content or you want to edit or update any of it, you'll see that there is a review and edit, and then there's edit content here. So you can click on the edit content, add any additional details that was or you feel that was missed out. So I'll just add here is and once you have added the details, you can click on Save Changes. And if you're happy with the content within the HPI, you can go ahead and mark it as reviewed. Now for each section, you also see the thumbs up and the thumbs down. And like I said, when you click on thumbs down, you can provide the feedback specific to that section. So let me go ahead and look at the vitals. So I'll go ahead and mark it as reviewed. No changes required here. I'll also mark the review of systems as reviewed. So it just captured that it's positive for fatigue and difficulty concentrating. The rest is negative. And the physical exam as normal physical exam. Then you have the assessment, which is persistent fatigue of unclear etiology, and the plan, wherein he has ordered few tests and prescribed vitamin D medication, the medication, and a follow-up in 1 week. Now, in case I need to work on this, and if I have not completed my adding the information that I need to be added here. So whatever is done, I can go ahead and save the draft. I can move on to the next patient appointment, and I can come back here and edit the details at a later time. But if you're done with the content or any information that you needed to add, you can go ahead and click on the Submit Final Note. So once you submit the final note, you'll see that all the sections are now marked as reviewed. The edit content is not disabled because once you submit the final note, it has created a progress note at the back. So I'll go ahead and close this pop-up and we'll move to the progress note tab. And you'll see here that the progress note is now ready. So you have the chief complaint, the HPI, the review of systems, the vitals, the physical, assessment, and the plan. Now, in case you need to add additional details to this progress note, you could always do it because all these details that you see here are also part of your patient chart. So if I go to vitals, under the notes section, you will see that the vital that was summarized and reviewed by the provider is available here. And similarly, for each of these sections, all those details are available under the notes. Now, one of the limitation that you can say here is that if you have a questionnaire that was specific to each or any of this section, like the physical exam, so those will not be part of your, it will not fill in your questionnaires here, but it will be part of your notes. So any summary that was derived after the conversation will always be part of the notes. And in case you need to add additional details here, you can either add it to the physical exam and go to the notes. So I'll just add here that so the exam of the abdomen was noted to be slightly tender on the lower right quadrant. And once I click on save, so this is the, go ahead and remove this and save it here. So instead of just the normal physical exam, you will see that whatever I've typed here is part of your progress note. So once your additional, and the other part is even if you have the dictate transcribe on your TOC, you will see that all these sections are available here and you could add details from here itself. And once you're done with the progress note is ready, you can go ahead and close your encounter and it will have your final progress note available to you. So based on the overall conversation that I had with the patient and which was recorded by the scribe, and then it was summarized, the provider reviewed the summary, and once they submit the final note, you can quickly review the progress note, close the encounter, and you have your final progress note done or available for your encounter. And like I told you, we also have the option to do it from the app. So I have the PrognoCIS EMR app available here. So let me go ahead and log into the app here. So once you log into the PrognoCIS app, you will see that you have the My Schedules tile here. You can click on the My Schedules. So it shows you all the encounters or the appointments for the day here. So you'll see that I have 4 appointments here which are shown. And then I can go ahead and make sure that the encounter is marked arrived. So let me go ahead and mark this patient as arrived. And once the patient is marked arrived, we have an icon here, which is the scribe icon just below the time tile here. So when I click on this scribe icon, it takes me back on the cell phone. It will show me the scribe screen. And like I said, when I click on the record, it will ask you for the patient consent. And once you have given the consent, it will start recording the conversation between the patient and the provider. Now in this case, you are in the exam room without your laptop and you just have your cell phone. So this recording will be done through the cell phone. And once the recording has been stopped, the complete conversation, the summary will be moved to the web here. So let me show it to you here as well. And I will go ahead and play a short recording of a patient provider's recording here. So when I click on the record icon, I'll have to make sure I get the consent from the patient. Click on save, and that's when it's going to start the recording.
Hi, Mark. Hi, Mark. I see you're here for abdominal pain. Can you tell me more about what you've been experiencing?
Let me go ahead and
Yeah, I've had this dull pain in my lower abdomen for the last 3 days. It started gradually but feels a bit worse today.
All right. On a scale of 1 to 10, how would you rate the pain?
Probably a 6 right now.
Any other symptoms? Fever, nausea, or changes in your bowel movements?
I've had some mild nausea and noticed I've been going to the bathroom more frequently.
Got it. Have you eaten anything unusual recently?
Not really. Just the usual. Maybe some leftover sushi 2 nights ago?
Okay. Based on what you've told me, we'll do a quick abdominal exam and order some labs to rule out infection or foodborne illness. I'll also go ahead and document this in your chart, but my AI assistant is already generating a draft of the note as we speak. I'll review it before finalizing.
So once I stop the recording, and if I come back to your laptop, click on the Scribe, you'll see the conversation here. You'll also see that it has summarized it, and the complete summary, which was broken down into those 5 sections, is available for you to review. And once you have reviewed all the sections, you can go ahead and submit your final note to create the progress. So that is about your Scribe feature, and that covers all the 3 features that we have as part of our first phase of PrognoAI. We would also be adding more features to the PrognoAI. So like you saw that there were currently only 5 sections where the context of the conversation was captured and dissected into. We would be adding few more of the notes, like the face sheet notes for your social history, so that if there is a social history that's being recorded within the conversation, it will add it to the specific social history notes. So that's something that's coming soon to these features. And just wanted to one more point that I want to make here is that if you're using the cell phone for the Scribe, it is more on for you to record the conversation when you're in the exam room with the patient. It does not capture the conversation if you're on a phone or a virtual call with the patient or on a telephonic call with the patient. So it only works if you have the cell phone placed between you and the patient when you're conversing. So we covered the past summary. We also covered the Scribe and the Scribe summary here. Now, ultimately, the idea of the Scribe summary is to make sure that you're not looking into your laptop when you're conversing with the patient, but you are having a eye contact with your patient. You're focusing on the patient, and whatever you're going to dictate or talk with the patient is going to be captured. You'll also see that if there are any specific context within the conversation that's not part of the medical, or that should not be part of the medical chart, the AI will smartly make sure that it does not add it to the progress note. If now we have a limited time early access offer to the PrognoAI, this early access program will be available to our selected customers. So if you are interested, please do reach out to the sales account executive, or you can also submit a request via support, and they will connect you to the sales team. And for the pricing part, the sales executive, when you reach out to them, they will let you know the different subscription plans that we have and limits that are part of each of those subscription plans.